Breast reductions are covered by most major insurance companies, but they all have their own criteria. For instance, some require patients to have gone through physical therapy or visits with a chiropractor or a personal trainer. They all require patients to have tried things like non-steroidal medications, ibuprofen, Advil, Motrin, and they all require patients to have tried bras with wide straps. Some of them want you to have lost a certain amount of weight. They're all different. Once a patient sees me, then I supply the insurance company with an estimate of about how much tissue I think I'm going to remove from each breast, and we also tell the insurance company how much the patient weighs. Each insurance company has its own algorithm where they combine the weight that we think we're going to remove and the weight and height of the patient, and then they make their determination as to whether they're going to pay to do the reduction or not. So to me as a plastic surgeon, it's always a bit of a mystery, but yes, most insurance companies will cover it as long as that patient falls within their specific criteria. Every woman wants to know what bra size she's going to wear after breast reduction surgery, but truthfully, we can't even tell you that. Most women that I see for breast reduction surgery aren't wearing the right bra size when they first come in for a consultation about breast reduction surgery. What I can tell people is if you're looking for an operation that's likely to provide you with a great look, a lifted look, and looking shapely and proportional, if you're looking for substantial improvements in neck pain and back pain and shoulder pain, breast reduction surgery would likely be a great option for you. Breast reduction surgery is pretty big surgery. During that surgery, we are altering how blood gets to the nipple, how blood gets to the other tissues, and then we take those tissues and we pull them tight and suture things together. We need blood flow to the tissues to be optimal so that everything heals well, and nicotine, unfortunately, constricts the little blood vessels and makes it much more likely that you'd have trouble healing the incisions. And if you don't heal well, of course that's a problem. You could need more surgery, and that just leads to more pain, more expense. So I don't do breast reduction surgery on anyone who's using any type of nicotine, whether that's smoking or vaping or patches or even nicotine gum. I don't do breast reductions on people using those products for those reasons. It's kind of interesting, really. Instead of having a lot of pain right after their breast reduction surgery, what a lot of women notice is that night right after their surgery, their back feels better, their neck feels better, their shoulders feel better. There's not usually a lot of pain with breast reduction surgery, and in most cases, the improvement in neck and back and shoulder pain is immediate. They notice it right away. It kind of depends on your definition of recovery. For instance, some people can be back at work after 1 or 2 weeks. What we really need is for people not to do anything strenuous for about 6 weeks. So I don't want people doing things like lifting anything heavier than, say, 10 pounds, roughly a gallon of milk, for about 6 weeks. So if your work requires you to do that, then you're going to be out longer. But if your work doesn't require that, or if you can work from home, then you can be doing things within a relatively short period of time.